just a warm welcome and a huge thank you to Paul as well, because bless him. Not that we feel sorry for him because he's in Australia, but a huge thank you to Paul for kind of staying awake till 1 to help us host this event. Yeah, really excited about OT Week this year because for me, and my passion for housing, how we can use the DFG, it is all about that stuff around prevention, which is what ARCOT's OT Week is about this week. And they've got the strapline right support at the right time. As many of you will know, we are working with the Royal College on the next iteration on housing without delay. And one of the things that has been a real privilege over the last 4 months since we've been working on the project is just the number of occupational therapists that we are meeting that are involved in some way around housing and how their roles in housing are really contributing in terms of prevention. So lots of OTs, and I know I've just seen that we've got people like Rachel Wooden on the line. We've got Jill, who will be speaking later, who actually get involved in the design of homes even before they're built. So actually we're designing homes for people that we don't know who they are, but what we know is that we're designing homes that will support people, so perhaps they don't actually ever need to come to social care. So for me, what I want to do this week with OT Week, what I want to do with the session today is kind of celebrate that work that we do as OTs in social care, the what we do as OTs in housing, and how we are really at the cutting edge of in terms of prevention. Because as I say, we're designing homes so that we actually stop people from needing to come to social care for that support. So what we've got today is we've got 3 brilliant speakers. So we're going to hear from Miriam, who's from York University. And Miriam was involved with Bath Out 2, which for the first time we've got absolutely brilliant evidence that kind of demonstrates the value and the cost effectiveness and what we can save if we actually get adaptations in quick. But also Miriam's got some exciting news about a new project that the team are working on at York, which is equipping. So we'll shortly hand over to Miriam that will take us through that new piece of research. We've then got Jill Pritchard, who is a brilliant housing occupational therapist that works in Scotland, and she's part of the team working on housing without delay. And Jill will be talking about some of the preventative work that is being done around housing in Scotland. And then to finish with, we've got a recording that we did a couple of weeks ago with a brilliant principal occupational therapy in Wiltshire, Mary Harvey. And it's just really nice to see the work that people like Miriam does at York University alongside the work that we've done previously with the Royal College of Occupational Therapists. Because what Mary has done is she's got some funding to do a pilot project that's bringing together the work with adaptations without delay with that evidence base from Bath Out 2 to do a preventative approach to using DFG, looking at bathroom adaptation. So we've got a presentation, a recorded presentation from Mary at the end. There is a chat box, so if people want to put any questions in that you might have for any of the speakers, then please feel free to add that to the comments box. But I will now hand over to and give a warm welcome to Miriam from York University, who's going to take us through the first presentation. So, welcome, Miriam. Thanks ever so much. I'll hand over to you now, and over to you.
Brilliant. Thanks very much. And thank you for inviting me to speak to you all today. So as Rachel said, I have worked now for the last 10 years on what was Bath Out and has now evolved into Quip In. So I'm going to give you a very brief update on Bath Out. I'm aware that Philip and myself and others have spoken to Foundations Live quite a lot about Bath Out over the years, but we'll focus more on equipping today to look to the future. So just very briefly, I have to mention that as the study is funded by the NIHR, anything that I say today that may be controversial is not necessarily the views of the NIHR or the Department of Health and Social Care. So, Bath Out. Those of you that know about Bath Out will know that it was the first national randomised control trial into housing adaptations in the UK. That study has now completed, and we're delighted to find that the evidence is there for us to be able to use now. The primary kind of headline outcomes from the study are that putting in bathing adaptation quicker has improvements on physical and mental outcome scores, which I'm sure is a shock to nobody on this call, but actually having that as an evidence base that we can refer to is really important. So we had secondary outcomes as well in terms of falls, fear of falling, social care related quality of life, independence with daily tasks, and ease of bathing, and the intervention was found to be beneficial in all of those aspects. And of particular interest was around the health economics. So by putting in a bathing adaptation earlier and not having people sitting on a waiting list, it was found that actually we were able to show cost effectiveness, reducing the need for other bathing resources, health and social care interventions, and so overall it costs less for everybody involved. And it was that particular figure, because of course everybody likes to talk money, that was of most interest to people when we went down to the House of Lords and were able to present earlier in the year. And you can see there's a picture there of a few of us, including Rachel, that were there from the team. We are still working on the publications for Bath Out too, so please watch this space, and we'll certainly be circulating them through Foundations when they're ready for people to use. So what's next? I thought this was quite interesting because it shows not only how research has progressed in the social care space, but also how graphics have come along in the last 10 years. So those of you that will know Bath Out too, you'll recognise the image on the left. And now to familiarise yourself with our new logo, which is the study called Equip In. So Equip In is essentially a follow-on study from Bath Out 2, but we're looking to analyse the full pathway of bathing interventions within social care delivery. So our short title is Enhancing Quality of Life Through Innovative Pathways for Independent Bathing. And so over the years, the programme is for 5 years. You'll see these logos and this title hopefully popping up in different areas. So please look out for them. We wanted to take a step back from finishing Bath Out 2. Bath Out 2 is very much at the end of the pathway, which I'm hoping a lot of you on the call will find familiar. But we realised, especially from doing the kind of qualitative assessments where we were speaking to people, that the beginning of the pathway, when those assessments were initially made, going through MIDA adaptations and provision actually was really important for us to investigate. So Equip In is essentially looking at that full pathway from referral, where a need is being identified by an older person or carer, when that's triaged and how it's triaged, depending on the different teams and where that person is based. If a minor adaptation is deemed appropriate, so thinking about bathing seats, handles, things that people could perhaps put into their homes without too much disruption. Then on to more of a formalised assessment, perhaps by a member of the OT team, and thinking about provision of different types of equipment from either a community store or a private contractor. Then on to referrals to housing. maybe where needs can't be met with equipment or minor adaptations, and then it might be that actually a major adaptation is then deemed appropriate. We've got the DFG assessment and further referrals as appropriately for the DFG, or potentially self-funding for those that DFG is not suitable for. And then hopefully, finally, the provision of the adaptation and the review process. So we're hoping that this timeline that we've built is fairly familiar to those of you that are on the call. If it isn't, please do let us know feedback if there's something that you feel we've missed or that we need to adjust and change. But it's this full pathway that we're looking to try and evaluate within the Equipping programme grant. So this is an image which I'm hoping will detail the programme of work that we're intending to complete over the next 5 years. We essentially have 5 work packages. So a work package is a kind of study within a study. So we've got 5 studies within the whole programme of work. Initially, we're going to be starting with work package 1, and that's my work package, and that is wanting to try and capture the lived and practice experiences. So some of you may have been approached by my colleague Gemma to consider joining our practice experience insight panel. That panel's now formed and has already started working towards our study documentation. And you'll see with the yellow that's threaded through all of the rest of the work packages that we were wanting to use our experiences from our public and practitioner members throughout every stage of the study. So they will feed into and review and work in co-production for each one of the different work packages. Secondly, we're going to have some mapping surveys and in-depth interviews, and I'll talk to you a little bit more about that in a second. The main kind of work packages are going to be a prospective cohort study. So we'll be looking at following people's journey as they go through that pathway and reviewing how they are progressing and their outcomes as a result of that. Work package 4 is our health economics kind of work package. So please forgive me. I am not a health economist, but I'll do my best to explain that to you all later. So that's a budget impact analysis and multi-criteria decision analysis. And then finally, our work package 5 is looking at recommendations and resources to support implementation. It's all very well and good to do this kind of work, but it's really important that we're looking at how we can then implement that into practice in the future. So, work package 1, public and practitioner involvement. So as I've just mentioned, we're going to be looking to work with people with lived experience, both as practitioners and also members of the public or carers. And we have formed 2 diverse panels, and we're currently meeting once a month. They sit independent to each other. They sit as sister panels, and at certain stages throughout the next 5 years, we'll bring those panels together to work in collaboration to work on specific things. Myself, I'm leading on that work package alongside Gemma Bradley at Northumbria, and we have a member of the public co-applicant, Claire, who is somebody who has lived experience of receiving bathing adaptations in her home as a disabled adult. As I've said before, we're going to have that continuous information flow in and out of all of the different work packages. It's quite a novel way. Those of you that are familiar with research will be familiar with the terms like PPI. And generally, PPI will sit kind of separate to the main parts of research and can sometimes be a little bit tokenistic. And we felt that it was really important that actually we highlighted the value of having public and practitioner input. So that's why we're leading with that from day dot, and then we're wanting to try and incorporate the co-design within each of the work packages as we continue through the stages. Work package 2, which we're currently working on the ethics submission for, is essentially a mapping exercise. So we're looking to try and map the current pathways to assessment and provision of assistive technologies in adult social care. We're going to do this in a couple of different ways. Initially, we're going to have a survey. So those of you that are working within local authorities will hopefully see this pop into your inbox in the next couple of months. And we're wanting to try and get details from up to 30 different local authority sites to get a handle on how the different local authorities are doing things. That could be, in terms of where you are in your geography, rural and more urban settings, and looking for smaller and much larger local authorities. We are then going to hold workshops, so those of you that are able to respond to the survey will be invited to come along to the different workshops, and those will happen alongside the public and practitioner insight panels. We're then going to develop a map. At this point, I'm not sure what that map's going to look like, but we're hoping to be able to identify methods of good practice that we would like to use as an example, which then we could offer as a way for other local authorities to adapt their services and learn from each other in that way. And similarly, we're going to have some interviews with members of the public who have accessed these different local authority services, as well as self-funders. So work package 3 is our main study that we're going to be completing within the Equipping programme. That's being led by Philip, Andrew Kingston and Joanne Gray. And we're wanting to kind of evaluate that effectiveness and cost effectiveness. This is very much a follow-on from Bath Out and is really important when we're looking to try and get that evidence base to show that what we are doing and you are doing out there on the coalface at different local authorities is actually helping and benefiting people. So we're going to do what's called a prospective cohort study, where we're going to compare different waiting times and look to evaluate the different effectiveness measures of when people are provided with equipment or minor adaptations. And importantly, from our evidence from Bath Out 2, the impact of waiting times and actually how much that does impact on people's overall quality of life. So for that study, we're going to be working with 8 local authority sites. So again, those of you that work at a local authority, look out for that work that's going to be doing. Inclusion will be for older adults, which is classed as 55 and over. I was shocked to learn. Closely approaching older adult life, I am. And we're going to be using standardised outcome measures. So those of you that have followed our Bath Out work will be familiar with these different types of measures. I won't go into what they mean today, but it is possible to look them up online. And then we're going to be doing a statistical analysis plan and a health ec plan as well to make sure we're getting that evidence base that we need. Alongside that, we will be doing a systematic review. Research can't happen without a systematic review. I won't go into the details of that, but that's something that we will be producing. And Mark Simmons is leading on that work package. So the health economics is really, really important for us. That was something that came out of Bath Out, that actually money talks. And so it was important that we were able to try and really dig down into what is cost effective and what isn't. So off the back of the cohort study, we're going to be delivering a budget impact analysis and a multi-criteria decision analysis. As I said at the beginning of the presentation, this isn't my field of expertise, but if you keep an eye on the outputs from the study, we will have much cleverer people than me kind of break down the important factors for us to digest in a little bit of an easier fashion. And then leading on to work package 5, we're wanting to really identify how we can implement the best practice findings that we are going to be. She says, finding from the studies that we're going to be delivering through this programme of work. And so Tim is going to be leading on that. Tim worked with us on Bath Out 2. And so we're going to be drawing on lots of different ways to analyse this in terms of interviews. We're going to be observing commissioners and providers of adult social care services. And again, those co-design workshops with our public and practice members, with the intention that we're wanting to develop a range of recommendations and resources to support that streamlining of pathways for different local authorities as an output of this programme of work. So the key outputs to be kind of thinking about with the 5 work packages is that we're wanting to develop the kind of a suite of inclusive study processes and materials, and that will be with both our public and practitioner panels, so that we're able to use those in future research and recommend them to other social care researchers. Certainly within Bath Out, we are in the vanguard of kind of evaluative social care research, and so we want to try and evidence our best practice when we're relating to public and practitioner members. As I mentioned earlier, we're going to be developing this map of common and innovative pathways, and that will be hosted online. So that'll be something that people who are interested, who work in the area, will be able to access and to use within their local systems. We're wanting to establish effectiveness and cost effectiveness findings, and the health economic outputs will be different models that will then be able to be used in future research. And then finally, if the back of work package 5, looking to determine effective strategies for implementation and improving development and evaluation of different interventions in the future. We do also have a PhD studentship, so any of you that are on the call that may be interested in doing a PhD, please let us know. We are looking for somebody with practice experience to take on this task. So something that really came out off the back of Bath Out 2 was the impact of assistive technologies for bathing for carers of older adults, and how that can have a huge impact on their quality of life. So we're going to have a PhD studentship that's due to begin in September 2026 that will run alongside the majority of the rest of the programme. And the focus of that studentship will be on the impact of assistive technologies for carers in their role in supporting older adults. So that's me for today. If any of you have any questions or queries, any feedback on that initial image that I showed you, then please do reach out to us. I've put up the Equipin email address, and I'm sure that can be shared with you otherwise. And thank you for listening.
That's great, Miriam. I think there are a couple of questions, so I'm hoping that Paul's going to work his magic from Australia and put them across. Somebody certainly, how will people be able to find out more about the PhD studentship?
Yeah, so we're going to have an Equipin website that's currently being developed now. We only started Equipin in September, so we are still just sort of getting up to speed. So details of the PhD studentship will be added to the website. We can also share it with foundations if that would be something that you were able to distribute in your mailing list. So absolutely, yeah, we'd be very interested to hear from anybody that's interested.
Yeah, just to let people know, I'm actually part of the research team as I was with Bath Out 2, so I'll be keeping people up to date. But yeah, Miriam, that's something that's not a problem. We can get that out into the newsletter. Somebody has asked, so I think it's I can't see. Lance has asked a question about how are you defining assistive technology. It's always a big one, isn't it? How you define assistive technology. So, but how are you defining assistive technology for bathing?
Yeah, and that's part of what we're going to be doing in that work package too, where we're looking to get practice examples, because we're aware that actually different local authorities may well define it differently. From our perspective, it's any type of external device that somebody might use to assist them with bathing. That could be a bath board, that could be a seat that they use to sit at the sink and strip wash. But yeah, that's definitely one of the questions that we're wanting to try and establish within that work package too.
Brilliant. I think that's it for questions. I know a couple of people have asked about the Bath Out 2 calculator that we've worked with the research team to develop, and I'm sure we can pop a link to that hopefully today. Miriam, just a huge thank you. For me, it's such an important piece of work is this. I was down in Devon yesterday in Exeter with about 60 social care and housing OTs down there, talking around kind of proactive and reactive prevention. And sometimes it is that bit around, we just need a better evidence base to kind of work out when is it do we put in major adaptations, and when do we perhaps withhold it. So I think this is an important piece of work, one to kind of justify how useful bathing equipment is, and those bits. So it's an important piece of work. So huge thank you, Miriam.